Hi, and welcome to Sidewalk Talk. I'm Steve Fortunato, founder of Shovel the Sidewalk. We're a marketing firm in Buffalo, New York. We help small businesses build brands and create advertising. We do it through authentic storytelling, and that's how we found ourselves. We landed on this podcast, which is all about storytelling and sharing stories of inspiration, information, education, anything to help people out. And we are real excited about our guest today. And there she is. It is Rose, Rose Dugan. No,
Duggan.
Duggan. I always, yeah, Rose
Duggan.
Duggan, not Dugan. I knew a Dugan. Everyone in Buffalo says Dugan, but you're not from
They do.
Buffalo. Originally,
No.
your story is just awesome. It's so unique, and I just think it can really help people. It's a story of, I'll say, perseverance, and it should inspire. So
Very kind.
Well,
Thank
Rose,
you.
so you didn't grow up in Buffalo,
No.
which is why you're called Duggan, not Dugan. So you grew up in Florida, ended up out in Hawaii. But what I want to get to right now, we'll get to where Rose works, which is where she's at work right now. She's the director of addiction medicine at Landmark Health Systems in Buffalo. But Rose, your story is so interesting in that. Tell us about when you went to school. Okay, let's start there. You went to college to do
The
what?
first time?
Yes.
Okay. So out of high school, I went to college. I grew up in Florida. I went to UNF, University of North Florida, wonderful state school. Go Ospreys. Um, and I thought I was going to go to law school after that. I was a double major studying English and political science. And all of my extracurriculars were geared towards that track, student government, mock trial team, very politically oriented. And that was my intention. That's what I studied the first time around. And I graduated magna cum laude. So
Not
I was
bad.
definitely on my way.
Right, right. So you get through that. While you were in school, though,
A couple
you
bumps in the
yeah, a little
road.
bit. This is where perseverance comes. You got a little sick.
I got a little sick. My sophomore year of college, I had some abdominal pain. One thing led to another, and I was diagnosed with Crohn's disease. So I had a surgery. I was on a bunch of meds. I had another really big surgery. I did some lengthy hospital stays. And I stayed in school the whole time, which looking back is unbelievable. And I was working. But, so I just stuck with it. And about a year after my really big Crohn's surgery, I had a bowel resection, 2.5 feet of small bowel and some colon left. About a year after that, I was not feeling well. I figured it was just side effects of everything I'd been through. No, it turned out that I had a rare side effect of some of my medications, and I had cancer. I had stage 3 Hodgkin's lymphoma. So then I went through cancer treatment for about a year and had more surgeries, chemo, radiation, the whole shebang.
And so yet, obviously, attitude is so much, and you obviously are a very positive person.
Thank you.
And it must have helped you. Maybe it also helped you were a little bit younger, right? Able to get
Well, I
through
mean,
this.
being young and being resilient helped. Having a really strong community. I had an amazing community. College life. I lived on campus. Um, there are so many just like friends and people to surround you. And the Jacksonville, Florida community was so generous. I was part of campus life, and some student organizations raised money to help pay for treatment. Just had a lot of support, which goes a long way. My mother and I decided early on that we wouldn't research any statistics about my potential outcomes. We thought, like, you can have all the statistics in the world and I could still be an anomaly. So we didn't want to get invested in what's happened to others. And then just, insisted on living my life. Like,
Mhm.
definitely just kept doing my thing.
Did you
Um,
research statistics after?
A little bit, yeah. And then now I'm very familiar with my long-term risk factors because I'm at a point in my life now where that is an issue. I've had secondary cancer. I've had some melanoma removed, which you're more prone to if you have radiation. And then I have a pretty beefy protocol that I have to follow now for early detection of other potential secondary cancers.
Yeah, I'm going through all that. You better stay on it, so you're
Yeah,
on it, right?
yeah, yeah.
So, I mean, talk about perseverance. So you end up, you graduate
I
after
graduate
going through
and
all that.
I'm working in a law firm and I'm studying for the LSAT and I'm watching these very intelligent, very educated people just spend their whole day buried in paperwork. And it felt so disconnected to me. Like the TV lawyer felt like it wasn't reality. And I felt like I wasn't really helping people. And it just stopped resonating with me. And I kept wanting to do something more. I wanted to do something that was more dynamic, that felt, you know, more more like my authentic self. I don't know. I'm having a tough time phrasing that part, but I didn't feel like it was me anymore. I'd been through such a big change. I was a whole new person after coming out of all the cancer stuff. So I did some time working in finance. I had a friend get me a job at Merrill Lynch back in the day, and it was a cubicle job. I was very good at it. The money was very good, but I just spent all day in a cubicle, and I couldn't figure out what I wanted to do for a couple years. Uh, and then I kind of invented this process to figure it out, and here I am.
Well, so then, but you went back to
I
school
did. I
because
had to
you
go back to
realized,
school.
but you like healthcare.
I like
Why is that?
helping people. And
Okay.
when I was back at Merrill Lynch and I was getting ready to quit, but didn't know what I wanted to do, I literally made a list on paper, things that I like doing and things that I hate doing. And then I looked at the like list and I thought, where are some common things that would create a job or a career? And so some of those things on there were like being outside, being in a different setting every day, helping people, using my hands or my body, like something physical. And so I started connecting those dots. On the hate list with stuff like paperwork, sitting at a cubicle, that kind of stuff. And I connected the dots on the like side, and I went back to my first original job, which in Florida was a beach lifeguard job, ocean rescue. I did that for a season, and then thought to myself, how can I make this into something with longevity? Because running and jumping into the ocean and swimming and hauling people out is amazingly rewarding. It's so fun. It's the coolest job you can ever have, but I couldn't see myself doing that sustainably for the next 30, 40 years. Um, so going back to school and pursuing nursing is what came out of it. I was like, it's like similar to lifeguarding in that you're a first responder. You're saving lives, you're helping people. There's a lot of healthcare involved in lifeguarding that people don't realize. It's almost all first aid. And
So
some
it's
of it
not
can
just
get
like,
pretty hairy.
not just Baywatch.
No,
That's not
no.
the real, that's
There's
not the
like
real
like
thing.
jet ski accidents, like,
Mhm.
you can have
Gotcha.
some really weird things. And I loved that aspect of it. I found the medical stuff fascinating. And my own experience as a patient had really changed my approach from the time when I was a 15-year-old and started till the time when I was in my, late 20s and still doing it. I really cared about how these people are feeling. What are they thinking? What are they going through? How do I support them? And it was from that angle that the idea of nursing came to be, because I was caring so much about the humans rather than like the exciting aspect of the rescue. I cared about the real people.
And the aftermath, you wanted to stay connected with them and learn and
Yeah,
make sure that so
that they
that's
did
pretty cool.
okay.
And
Yeah.
so then you went to school and you
Went
got
back to
your
school. Yep,
BA,
did a whole
right?
other bachelor's degree,
Wow.
got my bachelor's of science in nursing. And then I went down the path of this very wacky nursing career that landed me here.
And before we get to here, I do want to ask you, so if
Yes.
someone's listening and they're a young person and you know what, what's your advice? That maybe they don't know what they want to do yet, or maybe they're in school, or maybe they're doing an internship and now they're like, I don't know if I like this.
Yeah,
What's your advice? I mean, you
it's
pulled through.
super hard to know what you want to do for your whole life when you're 18 or 19 or 20 years old. And for me, I had no idea. My advice would be to consider the things you like doing And what about those things has longevity in a career aspect? Um, and gravitate towards a job that it would at least give you the opportunity to do those things that you like and that you're good at. You know, most of us have tons of interests that don't really translate into a career. I know so many people who are musicians and love playing music, but becoming a career musician is really hard. That's a tiny percentage. So finding other ways to connect to those interests can be helpful. And then my other advice would be have a bunch of jobs. Try out a bunch of jobs. I worked in restaurants, I worked in bars, I worked all kinds of wacky jobs. I was a nanny. I helped move office paperwork for people. And I think in those experiences where the commitment level maybe was a little more fleeting, I could see what I did well at in those different settings.
That's great advice.
Yeah.
Yeah, I mean, I'm just, are we
Hmm.
putting too much emphasis on these 18-year-olds to decide what they want to do the rest of their
Absolutely.
life?
Which I do want to say this, a very strong personal belief of mine is you are never too old to start over.
That's right.
You're never too old to make a change. If you are 50 years old and you're miserable at your daily job, it's okay to figure it out again.
Great advice. That's right on. Completely agree with that. You can always, yeah, you can't be miserable.
No,
That's
life's
that.
way too short. It's
Not
way too
only
long.
not only does it suck to be miserable, but it's also not healthy.
Mm-mm.
It's got to affect the body, right? It's got to affect your
Absolutely.
immune
Stress is
system.
the not so silent killer.
Yeah.
It has such a toll on people. Yeah, life is so precious and valuable, and having cancer brought that into focus for me at a very young age. I just couldn't fathom spending every day unhappy.
Oh, so great perspective. So, all right. So you went through all of, I mean, a lot of people, not a lot of people, I think, would have moved forward in all these different capacities. You've had so many curveballs thrown at you. So congratulations
Thank you.
just for your perseverance. It is truly inspiring, and I hope it helps others to hear that story and decide to move forward and take control. So then now you're in Buffalo, 8 years.
Yeah,
You've been here for 8 years.
yeah.
Hawaii to Buffalo, though.
Yeah, that's where I picked up
Interesting.
the Duggan. That was the ex-husband. He
Gotcha.
was
Okay.
in the Marine Corps. So
Gotcha.
stationed in Hawaii, then we relocated to Western New York together, and now we both enjoy happy, healthy, divorced, separate lives
It happens. Excellent.
all the
So,
time.
but now you're with Landmark Health Systems, which
Yes,
just seems to fit you, with your personality. It is, tell us about it. It's non-traditional,
it's a
unique
wacky place. I mean,
approach. Yeah,
I'm
tell
in
me.
my office right now,
Yeah.
and you can see like the tie dye behind me. We're definitely not your traditional corporate healthcare setting. I knew Dr. Mashi, Dr. Jared Mashi, is our CEO and founder, and this is his startup. This is his, you know, creation here. So he was basically a sole practitioner. He was renting a small space, had a couple counselors who would work in the evenings when he wasn't using that office.
Hmm.
I knew him. And in conversation, he, kind of jokingly said, "Oh, well, when we're at a point where we can afford you, I'm going to bring you on board." And I was kind of like, "Oh, haha, yeah, right." And then his other nurse had some vacation time coming up, and he said, "Can you jump in part time and fill in a little bit?" And I did on like the weekends. I was already working full time elsewhere. And then when the company was at a position where expansion was feasible, he offered me a very exciting full time job. And part of that conversation with him was, what do you like to do? Let's create a role around what you like doing. Because
Wow.
that's the beauty of a startup.
How about that? Yeah. Instead of
Yeah.
saying we need to fit a person into this position, you
Let's fit
created
the
a position for that
for the
person.
person. And that's kind of been how we've done it ever since. Every time there's a need, we look for someone who has that skill set. But once they're in the role, we have a lot of flexibility and freedom to then cater the role to them and then expand again for what we need next.
That's a really cool business discussion. I know we weren't
Yes.
going to focus on a
Oops.
we're going to talk about what you guys do, but not really the thought of business and hiring. I think that's such a cool approach that, yeah, obviously you have a need to fill, so that's why you look
Oh yeah.
for candidates. But then you figure out, what are not only what are you good at, what are you bad at. We'll try to manage those weaknesses.
Yeah.
But
Like
what do you like?
what do
What do
you
you
like
like to
doing?
do?
We have two medical assistants, and there's a lot of overlap in what they do, but there's also a lot about their roles that are really unique because we're playing to their strengths.
Yeah.
And we want them to have a role that fits them, that they like doing, that they're enthusiastic about. And when you play to people's strengths, that's how you get the best out of them.
Well, that's worked well for you guys.
Yeah, for us. And
So
like I
Landmark,
said, we're
yeah,
non-traditional. We're
yeah.
we're we're wacky. We don't have, a lot of the red tape that other facilities have to navigate. We don't have a board of directors that we have to answer to or anything like that. We just have our legal and ethical regulations of medical practitioners.
So tell us, there's a lot of services.
Yes.
You provide a variety of behavioral health services. And I want to walk through some of them because a couple of them I don't know what they mean.
Okay.
Um, but you specifically, you deal with addiction medicine, but you're also what? Are you the lead nurse? How does that work?
So yeah, I'm the medical supervisor, I believe is my title in that capacity. Dr.
Mhm.
Mashi is our medical director.
Right.
Um, so it's a big conglomerate of services, and we have the medical side, and then we have the clinical counseling side. So we have a whole team of mental health counselors. They offer a wide variety of modalities, and they come from all different backgrounds and education levels: PhD, licensed clinical social workers, mental health counselors, and they all have their different specialties and approaches. And then on the medical side, Dr. Mashi supervises the whole medical team, and we have a psychiatric nurse practitioner, we have a clinical pharmacist, a PharmD, myself, and our medical assistants. And so we deal with the big picture of someone's mental health. You know, I like to think of everybody as having this kind of inherent set of tools. And medications can be tools. The person taking the med still has to do the job, but I'd rather dig a hole with a shovel than with my bare hands. So meds are a tool. They can help you do a job. So is counseling. Counseling gives you more tools, coping mechanisms, all kinds of strategies. And so we find that by giving people lots of different options to help themselves, we can really provide creative, unique treatment plans for folks.
In other words, medicine isn't the only tool.
It's not the
It's a
only tool.
combination.
It's a
Yeah.
combination. And there are some patients who they're on maintenance meds, and that's about all they need from us. And then there are other people who really need a dynamic approach. So as the medical supervisor, I help manage our medical team. Things like patients having issues with their meds, or this pharmacy said this, or the insurance won't let me do that, navigating that kind of stuff, answering questions about side effects. We also have a couple of really unique services on the medical side that come together nicely with that unique approach. So we are medical marijuana providers. We we certify patients. It's not a prescription in New York State, but we can certify patients to participate in New York's medical marijuana program. We also have a synthetic ketamine program. It's called Spravato. It's
Yeah,
a
I saw that.
nasal spray.
Hmm.
We have this really beautiful historic ballroom that we've converted into our ketamine lounge. It's a very nice, relaxing space with individual little alcoves. And we do TMS, transcranial magnetic stimulation. And so I also supervise the TMS team. And that is a non-invasive, non-pharmaceutical treatment for medication-resistant depression.
Medication-resistant depression. Explain that, because that's one of the things I was going to ask was about TMS. So,
So yeah,
yeah.
TMS, so to back up 2 seconds, TMS is like a big spa chair that you sit in. It kind of looks like a dental chair without all the gear. And there is a tiny probe and the probe, comes around the side of the patient. And inside that probe is these super high powered magnets, like MRI kind of magnets. And when the machine is activated, the magnets move and the probe is placed, millimeters away from a patient's head, right over the part of the brain that is generating neurotransmitters. And that probe full of magnets, it induces electromagnetic currents that help create change inside the brain. So no
Like
medicine.
what kind of change? What are
Um,
we talking about here?
Trying to think of how to explain this to a wide audience. So it's not an instant change. It's not something that happens overnight, but over a course of treatment, studies find that the neurotransmitter activity is regulated. It's better managed, and that symptoms are alleviated. And sometimes patients can have a better response to meds that they've tried in the past after doing TMS. Well, the best thing about TMS, in my opinion, is what they call the long-term durability. So the results tend to get better over time after the treatment is done. So someone has the likelihood of feeling better 3 months after treatment than they did on the last day, and they might feel even better at 6, 9, or 12 months after. So you keep improving. It's basically like jump-starting your brain to get it to create the chemicals it needs and make sure they go where they're supposed to go. I call it directing traffic.
So then, who are your patients? Not like who needs you?
People who feel like they are not being heard by their current medical providers. I would say that the biggest piece of positive feedback I hear is, you guys actually care and you're actually listening to me. My experience as a patient, has taught me the hard way that our American healthcare system is very fractured. It's this weird experience of all these specialists who don't even know each other, who have, little to no communication other than sending notes. And it can feel like the left hand doesn't know what the right hand's doing. It can also feel like you have to wait months and months and months for an appointment, and then you get a little amount of FaceTime with someone and you don't get a lot of explanation. At least I felt that way personally going through the healthcare system. So the big thing we do is meet the person and get a big picture sense of who they are. What are they going through? What are their needs? What are their deficits? What's not going well for them? What do they want? And then we take a look at all of these unique services we have, and we come up with a custom tailored care plan for everybody.
So someone might come to you, even if they're struggling, I don't know, with weight loss,
Oh yeah,
weight
no,
gain,
we do
like,
weight management. We do weight management. We also have outpatient addiction services. So, people who have struggling with their body image and with their weight, and they're not sure, why they can't lose weight, for example. We have a lot of patients who come to us for help with that. And we start with the assessment piece. We start investigating, getting background. We'll order labs, we'll help look through their background of medical information to see maybe there's a medical condition that was overlooked. Maybe there's an endocrine issue that we didn't know about. And we start investigating and ruling things out. And then we can employ a combination of approaches that's best suited for the patient. Maybe it's working, with nutritionists. Maybe it's mental health counseling. Maybe there's a history of disordered eating. We also have pharmaceuticals that we can employ too to help. So it's all about finding what's going to work for that individual. No
so,
such thing as one size fits all.
I got it. So maybe someone just feels like crap,
Yeah,
right?
we hear that all the time. I just don't feel like myself. That's something I hear a lot. Just don't feel like myself. And sometimes patients don't know what they want or need. They just know that the status quo is not okay. And so that's part of the process is every single patient who comes to us, we start with a new patient evaluation and we book out at least an hour for that. I've had patients where I've done an hour long, eval and said, let's have you come back because we got more to talk about.
So do you think so? I mean, it sounds to me like we'll call it, I'm in marketing, so a definable
Yeah.
difference is really important, but it sounds to me like a major definable difference with you guys is actually at the beginning. It's the
Hmm.
discovery phase. There's
Yeah.
lawyer talk, right?
Yeah, no, it is.
It's
It's
figuring
discovery.
out your real story. So you guys dig in and get a story, whether it takes 1 hour or 2 hours, because
Yeah,
usually it's a 10-minute meeting, right? So
it
is
can be.
that it?
Yeah. Yeah, no, that's absolutely it. It's you got to know the whole person. I can see a list of symptoms on a piece of paper and know based on the textbook which medicine is going to treat those symptoms, but that doesn't always apply to the real human. And lots of times people are dealing with issues that they don't understand. Our culture doesn't have the greatest psychoeducation. It's getting a lot better. People are becoming more aware of how the brain and emotions and feelings work. We're becoming more aware of what mental health services look like, but the average person doesn't always have a really good idea of what going to a psychiatrist can possibly entail. So a lot of it is about teaching them, like, hey, these are some options you have available to you. What appeals to you
And what's going to work for you,
and what's
right?
going to work? And, people, the average person might not understand that talk therapy can exist in so many different ways. It's not just sitting in a room with someone and telling them about your day. There's all different kinds of approaches. I mean, there are approaches that are very structured and require worksheets and very specific exercises. And there is, of course, like talking to someone about what you're going through and helping process day to day. There's, a lot of different forms that mental health treatment can come in.
So did Dr. Mashi from the beginning want to have a non-traditional practice? Is that the
Yeah,
idea from the beginning?
yeah, he worked in corporate medicine too. He's worked in corporate healthcare and he loved the patient care. He loved forming relationships with patients, but he didn't like how inside the box everything had to be. One of his attitudes that I also share is if there's evidence-based proof to suggest that something works, just because it might sound wacky or it's new, if there's evidence to support it, we'll consider it. And so we're constantly adding new services. We were the first clinic in New York State approved to offer Spravato. So that's the ketamine nasal spray. So that was really exciting. We were on the forefront of that. We've been in medical marijuana for years, even before I came on board. So Dr. Mashi's been a participant in medical marijuana since it first came to New York State.
Let me ask about COVID.
COVID.
And I have young children. We want them to have what normalcy, get to school, interact, right? And
The
there's that
social aspect,
balancing act.
sure.
Yeah. I break it into two categories: adults and then kids. This has
Hmm.
been a mentally challenging 5 months
Oh,
thus
yeah.
far, right?
It's
Have
been an
you?
odyssey.
Yeah. Now, have you noticed that with your practice?
Absolutely. Absolutely. Um, we've taken on new patients who've come to us just because they're struggling to navigate this new world under COVID. And I've seen a lot of change in our pre-existing patients. It's been a very tough time for many people. The isolation, the disruption to routine for people who like to go out and about and do things, or people who aren't going to work anymore. On the flip side, you have how redundant it is for some people, and that becomes a grind. It's affecting everybody in so many ways. It's unprecedented for our generations, for the people who are alive today who live in the United States. We've never been through anything like this before.
Yeah, we're pretty spoiled. The last
Yeah,
couple of generations,
we're
we've been
pretty
pretty
lucky.
spoiled. So it's this is but I know there's not because there's not a one answer for everybody. I
No,
understand that, but do you have advice for like what can people do that are just like you said, some of them are just there's been so many
try.
changes and they're bummed, they're depressed. Well, maybe they're not depressed. They're just having a tough time. It
It's a tough
stinks.
time.
Yeah. It's just,
Um,
what can I do?
there's several things people can do. Number one, manage your expectations. Back in March, I was talking to patients. I said, don't think that this is going to be a month or two. Like, get into your head that like we're looking at 18 to 24 months. Because if you start to accept that earlier on, you can avoid the letdown every time you realize it's still going. And I don't think any of us know when it's gonna end and what the end even looks like. That's really hard to define. Is it the release of a vaccine? You know, how do we know when we're ready to go back to real life? We won't know until we get there. So for now, managing expectations that it might take a while. The big thing I've talked to a lot of patients about is find ways to evoke joy in your everyday life. If you're not going to work, if you're at home and it's very mundane, find new ways to stimulate yourself. Find ways to connect with things that you do like, even if you can't actually go and do them. Maybe that's like watching videos of live music on TV or watching travel documentaries to see other places because you can't go to them. If you're the kind of person who that brings you a little, reminiscent pleasure at the experience, for some people it might just be a bummer because they can't really go do it. Staying busy, staying occupied, staying stimulated, especially for the folks who are working from home and not going out much. A big thing I'm noticing is when you're working at home and you're in that same environment day in and day out, your brain doesn't get to process the amount of new data that it does when you're all over the place coming and going. Like think about driving. Think of how much work your brain has to do just for you to drive a car to work. It seems routine to us. We do it by rote, but in actuality, like that's a pretty impressive feat. You're taking in environmental factors, your defensive driving, you're wondering what all these other cars are going to do and keeping that in mind. You're navigating directions, it's hand-eye coordination. When I was working at home for 3.5 months, my brain didn't get to go through that exercise every day when I just walked from one room to the other room where my laptop is. So how do I engage my brain? I started doing Sudoku puzzles and paint by number. There is something called diamond painting, which if anyone listening doesn't know what it is such a beautifully weird corner of arts and crafts. It's super weird. But yeah, these things. I was doing Sudoku puzzles, different kind of like math puzzles, logic puzzles, because I wanted to make sure my brain was getting some stretched in some different directions that it might not if I'm just going from my bedroom to my office to work.
So it's mental exercise,
Mental.
just like physical exercise. If you don't, if you're going to get to atrophy if you're not
Yeah.
exercising that muscle. That's interesting. You're saying that for those that switch, because some people have worked from home forever, but for
Yeah.
those that have to switch all of a sudden and work
Hmm.
from home, that the stimulation of actually going to work worked your brain, and so your
Yeah.
brain hasn't been worked enough. So you
Your
got to
brain's
figure
not
out
working. Yeah, when
yeah,
you're at the office, you have to, you're looking at different people all day. You're reading their facial expressions. You're analyzing. There's so much subconscious work that you have to do just to go to your job, no matter what your job is. So for people who've had that big switch where now they're at home and it's very routine or monotonous or mundane, one of the things we've talked about a lot is find ways to stretch your brain in different directions. For people who are able to get up physically and move, I know that mobility issues, can affect a lot of people, but for those who are able to get up and move around, I can't emphasize how helpful physical movement is, intentional movement. I call it intentional movement. So not just, I did the dishes, so I was up and moving. Like designate some time if you're able to do something physical, whether that's gardening or taking the dog for a walk or doing jumping jacks in place. Because again, it's that stimulation. It's giving your brain and body a feast of data and activities to take in. So you're not just doing the same thing.
right. So work out the brain,
Work out the brain,
work out the body, which
or at
we've kind of
least
always known.
stretch it out.
Everyone's
Yeah,
always
exactly.
well. I mean, it's been well documented. Exercise is good. I think we've. I think I'm wondering if one of the positives of COVID would be even more awareness of mental health.
I think it is. I think we've been in an era of mental health getting a lot more attention the past several years anyways. Um, the younger generations of folks, the younger patients who come in, they're very well informed and they understand, um, that there are options available to help them when they're struggling, which is awesome to see. It's exciting to see people who openly embrace the idea of asking for help when they need it. Um, but yeah, I think that will definitely come out of COVID. I've heard a lot of, like on the news and social media and stuff, it's saying that that's the big after effect of COVID is going to be the mental health crisis that follows. I think we're already seeing it though. We're
Hmm.
already seeing aspects of it.
And I want to go back to something you touched on earlier too. It was I had thought that a while ago about a lot of the difficulty in not just with COVID, with anything is uncertainty.
Yeah,
And there is, I mean, like you said, I mean, is there going to be a vaccine? Are there going to be is this thing going to just go away? Where we thought it would go away in the summer, it's going to be too warm. Is hydrochloroquine? What is it that's going to help us get through this? Is it mask? No mask? Now it looks like mask for sure.
it's masks for
Um,
sure.
yeah, mask for sure. But it's the mental approach to me is accept the fact that you're just not sure. I mean,
Yep,
you just don't know. And if you to your point is, so we may be another year, and so pretend it's another year and a half. Just accept it. Then if it's any
accept it.
shorter, you've managed that expectation,
Now
right?
you get a present. Exactly. If it ends up being shorter, that's a bonus. That's the cherry on top. But if you're preparing yourself for the long haul now, you're not going to keep getting let down every time it doesn't come through for you. In all things in life, there are always so many factors that are outside of our control. And that's something that we always see patients grappling with is these factors that are out of our control. And I always like to talk to folks about like take everything that's in your control and put it in one hand and everything that's out of your control and put it in the other. And now focus on the stuff that you can actually control because that's where it becomes so stressful is trying to fix things and worry about things and predict things that you just can't. I can't control someone else's behavior. I can't control the outcome of COVID. I can't control when a vaccine will be developed. That's just out of my personal power right now. So, what's in my personal power? What can I actually have a say in? I can have a say in what I do day to day, my routine, how I invest my time and energy, the things I eat, the things I listen to, the things I do every day. And so that's where I find it is more productive to invest your focus.
Did you learn that through your cancer battle?
Probably,
Yeah.
probably.
I
I
mean,
mean, yeah, probably. I grew up in a wacky household. I love my family very, very much. Um, but probably even younger than that, just always kind of learned to roll with the punches.
yeah, it's pretty apparent. Really cool. So, uh, Landmark Health Systems, you are in Allentown in
Yeah,
Buffalo.
accepting new patients.
Yeah, and accepting new patients. There's a plug. So psychiatry, addiction medicine,
Yep.
medical marijuana. I don't
Chronic
know
pain,
what. Yeah, pain.
mental
Yep.
pain, mental health, weight management, depression, anxiety. Even if you don't even know where to start, we'll do our very best to help.
What's ketamine therapy?
Ketamine, that's the Spravato, the synthetic
Oh,
ketamine.
got
Yeah,
you.
ketamine
Okay.
is a dissociative psychedelic drug, chemical, and it's had a role in medicinal pharmaceutical use for a while. Its use in mental health is something that's newer. That's pretty exciting. And Spravato is a synthetic form of ketamine, and it's delivered through a nasal spray. So patients get cozy in a nice lounge chair with some blankets and dim the lights, and they self-administer the nasal spray, and then they hang out with us in our lounge for a couple hours, and they get to feel the effects, and then then it relaxes off.
How does that differ from medical marijuana? and the effects of it. Medical
The
marijuana they can do
effects,
at home, right?
medical marijuana you
They
do
can
at
just
home.
do at
Medical
home.
marijuana you get certified
Yeah.
by a provider, and then you go to a dispensary and get the products, and then you can use it on your own. And there's a dynamic range of products. There's all different kinds of strains and strengths, and CBD versus THC. So that's a very exciting world. The effects of Spravato, it's probably pretty intense, compared to medical marijuana. But again, some medical marijuana products might also be pretty intense. The threshold I always use is you shouldn't drive a car. So there are some medical marijuana products that you should not drive a car when you're using them. Spravato, you cannot drive yourself home from the appointment. You have to have a designated driver.
Cool. Well, this has been interesting. I'm fascinated by your story and your attitude. Your
Thank
attitude is
you.
great, and I think people can learn from you.
I mean, it's not, I'm not, I don't know. I guess I want to say I'm not like perky and upbeat every single day. I'm human. I have my stressors. I have my bad days. But the first place to start making your life better is to just make the decision that you want to make your life better. You have to gravitate towards people and things and actions that make you happy, that bring you joy. And so even on the most stressful, hard days, I have to give myself, access to the things that make me smile, whether that's like the music I listen to on my way home or the food I eat for dinner. You have to find ways to make sure you get that access to the best of your ability.
Great advice. So listen, if someone out there, if you're listening or watching on YouTube, if you're not feeling like yourself, if you feel like maybe you're not being heard by
You're not
your,
coping.
yeah, or your, I don't know, your primary care just isn't hearing you or whatever, not some are
Primary
great.
cares are amazing. They're the
Right.
backbone of the American healthcare system. I love my
Mhm.
primary care physician. She's incredible. But they have to be able to treat so many things and have such a wide awareness. The benefit of coming to a specialist, like a psychiatrist, here we are, mental health world, is that this is our jam. Like, this is what we're focused on. And the depth of knowledge we have about the different meds and treatments and modalities, it's going to be so much richer or more rich, which is correct? Richer?
Richer.
It's going to be richer than what you could get at a primary care physician. And then we both have to cooperate to take care of the whole person, because your brain doesn't exist separately from the rest of you.
Yeah, you don't want to abandon the primary care. What you're
No,
hoping for is a partnership, right? Because
exactly. And that's what we like to do. We like to collaborate with our patients' other providers. We like to help with that continuity of care. We have patients who come in and they're like, I have a counselor already, but I think I need medicine. Okay, well, we'll work with your counselor. Or I'm
gotcha.
already on meds, but I need someone to talk to. Okay.
Right. So you would actually work with not just primary cares, but other counselors as well.
Yeah.
You guys do.
And we coordinate care with all kinds of specialists. We
Okay.
have patients who end up getting referred to endocrinologists, or, I'm working on something today for someone who needs to go see a sleep specialist.
Mm-hmm.
And so we'll help coordinate that and connect the dots. If there's other physical health problems going on, your mental health is always going to be affected. In nursing, we say all nursing is psych nursing, because your mentality always matters in every other way. So when you look at a person as a whole, a big picture, and you have to take care of all those different needs. You can't just isolate. You can't just have talk therapy but ignore the tooth that's hurting.
Are you connecting with other? Are you whatever? I mentioned PCPs earlier. Whatever. Of other doctors, of others in the industry, are you getting
Sure, we reach
pushback
out.
from them? Are you connecting?
No, we try. We I don't always have like an hour-long conference call with a primary care about a patient, but there's definitely times where we're exchanging information and really talking. I've had endocrinologists who send me messages to talk about a mutual patient. I have had lengthy phone calls with patients, other providers to help coordinate that care. Sometimes it is just sending notes and doing that. Um, Lots of counselors reach out to say, hey, I know you guys manage so and so's meds, but I noticed this at their last appointment, wanted to keep you in the loop. And it's helpful. The communication is helpful. Have we received pushback? No. I mean, we're small, we're a startup. We don't have, I guess we don't have a ton of name recognition necessarily. Maybe that's part of it, but we've been working to get our name out there. Last fall, we did a provider open house event that was awesome, and we invited a lot of area providers from all different aspects of healthcare and mental health to come meet up with us. And we do collaborate with other mental health providers.
Right. So
Talk
it's
to folks all
not,
the time.
we're not pushing and advocating to dump your providers. We're just saying, so if you
No.
feel like you just maybe not completely being heard, or you need something, and
Yeah.
maybe Landmark can be part of the team here, and
There
we
you
can
go.
help with
The
the team
team.
care, right? Team care. I got you.
Exactly. That's what we like to do.
All
And
right.
every person's different. So yeah, we got to just cater to the individual.
Well, Rose, I appreciate your time. I really love to hear your insights. I appreciate you sharing all the advice that you gave everybody. Hopefully, it has helped people. It is
I hope
Landmark
so.
Health, Landmark Health Systems. Uh,
Yes. That's
Rose
us. Well,
Duggan is
well,
the director of addiction medicine, and it's Dr. Mashi,
Mashi.
Mashi,
Yep.
Dr. Mashi.
Jared Mashi MD.com is our
Okay.
website. So JARODMASCI MD.com.
Check it out. The worst thing that
Yeah.
can happen is maybe it's not a connection. Okay. So, but the only way is to go and meet them, talk about things. If you're not
Yeah. And
feeling right,
that and that's for folks in the
right?
Buffalo area who feel like
Hmm.
they need that help. If you're listening or watching and you don't live anywhere near me, look check out what resources are available in your area. See if there is a mental health provider near you that does offer some innovative approaches, and look for that kind of a mentality. I've helped people do that too. They're like, oh, I'm moving to so and so, who would you send me to? And those are the kinds of qualities that I would look for. Who seems innovative? Who mentions that they care about the whole person and that, they have this dynamic approach.
Great.
And
Well, I
don't settle.
appreciate it.
Yeah,
Yeah. Don't settle. Don't
don't
sit on
settle.
it either.
No,
Don't
if
sit
something
on
is
it.
not right, ask for help, please.
All right. Rose, thank you again. Landmark Health Systems in Buffalo. They are
Thank
in the
you for
Allentown
having.
neighborhood. Sure. Thank you.
Thank
Thanks
you
for your
so
time.
much.
Great story. Congratulations to you. Keep fighting. Keep fighting the fight. And look forward to connecting with you again real soon.
Thank you.
All right. You can download all of our Sidewalk Talk podcasts on your podcast platform of choice, whatever it is, iTunes, Spotify. You can also watch any of our podcasts by visiting our website, shovelthesidewalk.com. And if you have a story, or someone you know has a story that, like Rose's, that you think needs to be shared, heard, it can inspire, inform, or educate anybody out there, there's a form you can fill out, simple form on our website, and we'll get in contact with you and we'll help tell your story. So thanks again for watching, for listening, for participating. I'm Steve Fortunato, and this has been Sidewalk Talk.